Hello, everyone. Welcome to tonight's webinar. I am just figuring out how to share my screen. Sorry, Dana, I don't see it anymore. The button to share. So as Dana helps me with that, oh, there we go. There we go. All right, everybody should see that now. Hello. So I am Jacqueline Thomas. I'm the current CAGC student rep. So to the Canadian Association of Genetic Counsellors. I'm also a recent grad from the McGill University Genetic Counselling Program and a new genetic counselor who's working in Saguenay-Lac-Saint-Jean, which is in northern Quebec. And so I'm going to be hosting tonight's webinar. I'm very excited to see that so many of you have joined us. And so what we're going to be talking about, of course, is genetic counseling training programs here in Canada. And it's going to be really a Q&A with current students during this webinar. So the brief outline of what we're doing here is we're going to talk about genetic counseling as a profession, as well as the Canadian Association of Genetic Counsellors. I'm going to give you an overview of the genetic counseling programs here in Canada, and I will talk about the application process globally. So gaining relevant experience, preparing an application, preparing for interviews, and the matching process. So all that will be about 25 minutes, and then we'll get into the meat of the session, which is of course our Q&A with the current students who'll be joining me on the screen, and I'll introduce you to them as we get there. So a few housekeeping items before we start. All participants are going to be muted for the duration of the whole entire webinar. I invite you, of course, to ask your questions in the Q&A box. As I'm talking with this beginning portion and during the Q&A session, and then we'll be answering those questions, like I said, at the end. If you want, you can ask the questions in French or in English, but the whole webinar will be in English this evening. The duration of the webinar is set to be about an hour. We may go a little bit over depending on your questions, so please feel free to send them, but we will definitely be ending before 8:30 Eastern time. If anyone needs to leave early or joins late, there's no problem because we will be recording the session and it will be posted on the CAGC website in the weeks following this event. And so I really hope that all of you really enjoy the webinar tonight, and I think you'll find it helpful as you prepare your application for a genetic counseling program. So let's jump right in. First, of course, is an introduction to genetic counseling. This many of you are likely very aware, but who are genetic counselors? So we are healthcare professionals with master's levels training, specialized in medical genetics and also in counseling. And genetic counselors work as part of a healthcare team and perform lots of different roles, including providing information on the nature, the inheritance, and the implications of genetic diseases. And they help people understand and help people adapt to the medical, psychological, and familial implications of getting a genetic diagnosis. And of course, they engage individuals in informed decision-making when deciding whether or not to engage in genetic testing. So GCs work in varied disciplines: prenatal, oncogenetics, general genetics, adult and pediatric, as well as many, many more. Where do these genetic counselors work? They work, of course, most of them in direct patient care positions, so usually in hospitals or in private clinics. As you can see from the pie chart there, it talks about where people are working. So like I said, in patient-facing roles is the majority, but some also work in non-direct patient-facing roles, like in labs, in industry, in research positions, or in public health and policy. And most genetic counselors also have roles as, of course, as educators.
Hi, Marie. We can't see your slides. Can you try sharing them one more time?
Oh, I'm so sorry.
It's okay. It's just a blank screen right now. And
okay. You can't see them now, huh?
Just a blank screen.
Okay. Show. If I stop showing it and try again, let's see. No, huh? That's very odd. Oh, okay. I'm so sorry.
Oh, that's okay. Do you want to go back a little bit or?
Yeah. So I was just going through who genetic counselors are. This is the information that I verbalized. I was showing this graphic here from the 2018 professional status survey, where most genetic counselors do work in direct patient care positions, but some do work in non-direct patient care positions. And I was getting to this one. So I'm glad you can all see my screen now. I get this question a lot, what the average salary is for genetic counselors here in Canada. This is again from the 2018 professional status survey. And so the average salary is about $87,000, but that's very variable depending on where you work. Typically, GCs in patient-facing roles do make a little bit less than those who work in industry, and it varies widely between the different provinces. But to give you an idea. So I also wanted to touch on what is the CAGC, so the Canadian Association of Genetic Counsellors. We are, of course, an organization that is really the goals are to promote high standards of practice in the genetic counseling community, to facilitate and support professional growth, to increase public awareness of who genetic counselors are and what we do. And the CAGC is also involved in the certification of genetic counselors through the board exams. So membership, of course, is open to genetic counselors, genetic health professionals, and of course, students. And students do get a discounted rate, which is very fun. And prospective students are also encouraged to join as student members if they would like. Some benefits to being a member of the CAGC includes online membership, directory of genetic counselors in Canada, a CAGC electronic mailing list, job postings that are on the website specifically for members, lots of educational opportunities. We just had our annual education conference at the end of October, and there are multiple webinars that are organized for membership, discounted rates, of course, for the conferences, and lots of volunteer opportunities, which we might touch on again later in the call. I do also want to say there are about 350 CAGC members as of now. So there are lots of us, and it's a growing profession, so that's always very exciting. So getting into, of course, what you're all here to talk about, which is an overview of genetic counseling programs here in Canada. So in general, how do you become a GC? You first start with a 2-year Master's in Science program in Canada or abroad, of course. And the coursework of these training programs includes clinical rotations, coursework itself, and a research component for most schools. After the 2-year master's program, most genetic counselors decide to write the board exam, either the Canadian one by the CAGC or the American one through the ABGC, or both. So the universities in Canada, there are 5 that offer Masters in Science in Genetic Counseling. From west to east, they are the University of British Columbia in Vancouver, the University of Manitoba in Winnipeg, the University of Toronto in Toronto, and in Montreal there is McGill University and the Université de Montréal. So each of these universities is unique. They all have differences in their curriculum, how much they put on coursework versus clinical rotations versus research. And I'll let the panel kind of touch on this a little bit later if you have questions about the differences. But I encourage you to visit the websites for each of the universities, because of course that's where most of the information about each of these universities is available. All these programs are English-based, except for the Université de Montréal, which is a French program. However, McGill's program also has a clientele of French patients. So for clinical rotations, there is some patients who will be speaking French. So that's something to consider as well when you're looking at what universities you would consider applying to. Of note as well, all of these universities are ACGC accredited, meaning that somebody who finishes the program can write the American board exam, all except for the University of Montreal, which doesn't currently have that designation. But the University of Montreal students are eligible to write the Canadian board exam as well. So the application process as a whole, we're not going to hide it. Getting into genetic counseling is definitely competitive. Each school in Canada will take about 3 to 6 applicants per year. So 5 schools, 3 to 6 applicants per year. Many students who apply to genetic counseling programs will apply to more than one school when they're applying. And some will also apply to American programs as well. And so here tonight, we will be speaking mostly about the Canadian schools and our experiences. We will do our best to answer questions about applying as a Canadian student in the States as well. If you have questions about that, please submit them. So the way I see it, there are 4 main steps: gaining experience, applying, interviewing, and matching to genetic counseling programs. So we're going to jump right in. The first one being gaining experience. So most of the programs will encourage you to have a relevant mix of experience as you apply. So some of the things on this slide are requirements to apply to the programs, and some of them are kind of nice to have additional things. So going over these together, all the programs do require that you have relevant undergraduate program experience. So that could be in genetics, in biology, and psychology, and any other connected program, as long as you have the prerequisite courses. And these being quite competitive programs, there is a minimum of about a B+ average. So that again is generalized. The specific information for each school, please look at their websites. But as well as the relevant undergraduate experience, all of the programs do encourage genetic counseling exposure. So that can look like shadowing, volunteering, internships, things like that. Those are kind of traditional ways of getting genetic counseling exposure, understanding what the profession is. But I'm going to touch on some maybe non-traditional ways, especially in our current COVID context, that people can get some genetic counseling exposure. After that, another requirement for all programs will be counseling experience. This is important because during the duration of the training programs, you'll be doing clinical rotations and seeing patients. So counseling experience beforehand is really important to help have a kind of baseline of those counseling skills. So people can get that experience through crisis lines, through peer support centers, through family planning or sexual health clinics, really any place where you can get that experience of one-on-one talking and counseling with clients. After that, the programs do encourage that you might have some advocacy work experience or some research experience. So when I say advocacy work, I mean being implicated in support groups, in community outreach, or in professional organizations like the CAGC. And so that's kind of where those volunteer positions can come into play. It gives you kind of an idea of the lived experience of people in who might have different genetic diseases. Let's say if you were in the support group. Then for research experience, it can be graduate, undergraduate, it can be work experience or volunteer experience, really anything that kind of gives you general exposure to the research process, to study design, and to scientific inquiry. And that becomes important because there are research components to genetic counseling programs. So, like I said, it's not always easy to get in-person kind of traditional shadowing experience. We know that in Canada, we're a very big country. People live all over the place. We're not all necessarily close to genetics clinics and able to go shadow. Genetics clinics can be really busy and don't have the capacity to have people come shadow all the time. So there are definitely barriers there. So some other ways to gain exposure can include anything that helps you immerse yourself into the profession. So there are a lot of podcasts that I've listed here on the slide that can be really helpful in getting information about what it's like to be a genetic counselor. Another thing that we encourage, of course, is reaching out to current students or current genetic counselors and asking if they would be open to having a coffee date or a video call just to kind of talk, get a feel for what it's like a day in their life, let's say. So contacting local genetics clinics, contacting the Canadian, the CAGC student rep like me, or program directors, we're all kind of there to answer some of those questions. Volunteering is another great way to gain exposure and an idea of, like I said, the lived experience of people who are either using genetic services or who are like professionals in the field. Let's say if you were volunteering with the CAGC, you could get an idea of what it's like to be a genetic counselor. Educational experiences are really big too. Any webinars that you can attend, conferences, reading publications that are relevant to genetic counseling, those are other great ways of getting an idea of what the field is all about. And of course, if you're not able to shadow, there is a series on YouTube, Genetic Counseling in Action. It's a series where they have mock genetic counseling sessions that you can watch, and that also gives a really great idea of what genetic counselors do. And again, I think that's really important when preparing an application to have a great understanding of what a genetic counselor is and if you really see yourself in that kind of role. So once you've gained experience, you've looked at the different schools, now you're kind of at that step of applying. So applications, of course, are different for each of the different schools, but in general, the process includes sending in application forms and sending in an application fee, sending a CV. Sometimes there's a proof of language proficiency to provide. And then the meat of it is really 3 reference letters and a personal statement, as well as being registered for the match. The match we'll talk about a little bit later. So for the reference letters and the personal statement, we will definitely be addressing that in the Q&A. But just, my personal experience with this is for reference letters, I think it's very important to ask people who know you well and people who can attest to your skills. And so preferably these would be people who know you in different areas of life and can kind of talk about different facets of your life, different skills that you have. For me, when I sent in my application, I actually sent 1 academic reference letter, so someone from my university, 1 crisis line staff member, and then somebody from my work life. I worked at Health Canada, and so they were able to attest to kind of my professional skills. So those people are all able to kind of say different things about you in different walks of your life. For the personal statement, of course, again, very important that it's a personal statement. It's something that it's your chance to really show the admissions committee who you are, what you're all about, that you know what genetic counseling is, that it's something that you want to do and something you see yourself doing, and why, right? And what skills, what things have you done to develop those skills in order to be ready for the profession. So I actually also found it helpful to send my personal statement to the people who wrote my reference letters so that they could kind of comment on the same skills and things that I was actually trying to highlight to the admissions committee. So again, we'll touch on these again because I know these are things that you might all be working on right now in the application process, kind of those personal statements and reference letters. So after the applications are sent, which is typically by mid-January, then we're going to get to the interviewing part of everything. So typically invitations for interviews go out in late February, early March, and interviews typically happen in March and in April. It's definitely going to be different this year with the pandemic context. So I know last year a lot of the interviews had been by video conference, but we'll see what it looks like this year. All the schools are going to be different, but they could be in person or video conference interviews. And these interviews, of course, have variable interview structure. They can be one-on-one, they can be the admissions panel who's talking to you, there can be mini interviews. It really depends on the school and their structure. And often there are other activities around the interview day to give you the opportunity to get to know the program itself. So that can include things like attending classes or educational activities, having meals with faculty or current GC students, or maybe kind of coffee online. Sometimes there are writing samples or other little assignments to do. All those are very variable and depends on the school itself. But they all can be helpful for you too in getting to know the program a little bit more. And then lastly is the matching process. So of course, as part of the application process, you will need to register for the genetic counseling admissions match. and pay the fee for the match as well. And this system is a process that helps streamline the application process and accepting the offers for the universities. And I think it's the 4th year that it will exist. So really the general process is that when you apply to a GC program in North America, you register for the match. After interviews are completed, you will rank the different schools and they will rank you as well. And then there's an algorithm that does its best to match people with the school and the applicant as best it can based on the preferences of both of the parties in order to send out a match. So what school you will have matched to, or if you match to a school. All the universities that are ACGC accredited are part of the match. That means that the University of Montreal, to my knowledge, is not part of the match, the matching process. So if you're applying to the University of Montreal and another school that is part of the match, there's a framework in place already that helps figure out, that gives you the opportunity to accept one of them before accepting something from the match. So again, I won't go into all the details because the matching process has a lot of online materials that you can have access to that really gives information on how that matching process happens. We can talk a little bit during the Q&A about strategies or kind of what factors we considered when matching. But one other thing I want to mention is that I think it's very important on what we call match day, so the day that the results go out, which is April 23rd, 2021 this year. I think it's very important to practice self-care. For me, on matching day, I did not go to work. I planned activities with my friends just to make sure that whatever the results would be, I would have something to look forward to as well, and people to be with and to help me through that. So one last thing I want to address before we get to that Q&A portion that we're all waiting for are some resources for underrepresented students. So one thing that I think is important to mention about our profession is that we're currently made up of mostly white women. There's a very strong lack of diversity, and it's something that as a profession we are looking to address and trying to identify what those barriers might be for other people and helping find ways to get rid of those barriers. So I do want to point to a really great resource, which is the Minority Genetics Professionals Network, the MGPN. It is a US-based program, but what they do is they offer mentorship programs as well as forums and opportunities for you to connect with other people and kind of discuss what these barriers might be, what ways you can get through them, and other strategies. So they do have a mentorship program that current students can use as well as prospective students to really talk to someone and kind of get some information. Another important thing is there is a GC, I believe, from the University of Texas, who is doing a survey that is looking at barriers experienced by underrepresented minority applicants in becoming competitive genetic counseling applicants. And so if that is something that compels you, I really do encourage you to go fill out that survey, because it will give us important information for the profession on what we need to do, what we need to address to really break down those barriers. So with that, we have come to the end of this brief presentation and to the Q&A session. I am so excited to hand over the mic to my lovely panelists who are joining us. So just before I invite them to introduce themselves, I do want to emphasize that we are speaking about our own experiences here during the Q&A session. The answers to your questions are meant to help guide you in your application process, but specific questions regarding the training programs themselves and the nitty-gritty details of the applications, we're not on the admissions committees, so those are best addressed to program directors directly. But of course, we are very excited to be able to share our experiences with all of you. So I am going to invite my panelists to unmute themselves and share their videos, and I'm going to stop showing my screen. There we go. Hello, everyone. And I'm going to invite them to introduce themselves. We're going to start on the West Coast with Amy from UBC. So go ahead, Amy.
Hi, everyone. My name is Amy, and I am a second-year genetic counseling student at UBC. I'm from Vancouver and did my undergrad degree at UBC in medical laboratory sciences. And I found out about genetic counseling actually towards the end of my undergrad trajectory, so somewhat late. And when I found out about it, I think this is probably not going to be a unique experience, but what really attracted me to the field was really the opportunity to integrate my interest in sciences with something that was patient-facing, something I could talk to people regularly and provide counseling and support for. And I suspect that the other panelists may echo something similar when we get to them. So I actually applied 3 times total. So the first time I applied was kind of right out of undergrad. And to be honest, at the time, I didn't have a good sense of what genetic counseling was and didn't have any actual shadowing experience. So I only applied to UBC. And in retrospect, maybe it wasn't the best idea at the time, but now that I think about it, it was super useful for me to get my foot in the door to understand kind of what the field was all about and what kind of how I could go from there. Not that I recommend everyone do it that way, but that's my experience that way. And so I didn't get an interview that year and applied again the second year, having much more experience in sort of all of the different areas that MJ had mentioned in her presentation that are helpful. And that year I applied to 4 of the Canadian programs and I interviewed at 2 of them, one of them being UBC, and did not get matched that year. And so I applied again the next year, and this time I expanded to applying to schools in the US as well. So I applied to 7 schools in total, including again the Canadian programs as well, and I interviewed at 5 of them, and then eventually matched back here at UBC. So all comes full circle. But here I am, almost finishing up the program, which actually seems crazy now that I talk about it that way. But just kind of generally speaking, some of the experiences I had to prepare kind of applying and getting into programs are actually very much what MJ had talked about, getting experiences in genetic counseling, shadowing, volunteering, getting experience in research. And sometimes some of that takes time, and some of that takes you going up to people or cold messaging people, cold calling people and trying to get it on your own. But I would say in that aspect, it's very much kind of what MJ had already said. And I can go into that later if some questions come up about that, but I will pass it on to Cassie.
Awesome, thanks, Amy. It's nice to hear about your experience, right? And how, yeah, sometimes we don't get in the first time and we get more experience and we apply again, right? And so really a testament to your perseverance. And so, yes, we'll move right on to Cassie from the University of Manitoba.
Thanks, MJ. So yeah, I am from BC, and I also did my undergrad at UBC. Actually, there's a lot of things that me and Amy have in common, but we'll get to that in a sec. So I did my undergrad in biology, and I took a lot of courses in physiology and genetics, whatever was available. And I started thinking about genetic counseling maybe in about second year. I was just entering the co-op program. So during my program, I did a lot of different kinds of jobs in research, one in a developmental biology lab and then in a medical genetics lab. And over the time of my undergrad, I started getting experience in counseling as well. So I volunteered at the crisis line in Vancouver. Before I finished my program, I applied for the first time to the genetic counseling program at UBC, and I kind of made the decision that year that I was only going to apply to UBC as well. And it was I was very hopeful that I would get an interview that year, but I did not, and I was discouraged. But at the same time, I want to echo what Amy said, is that this was a really great experience of I was able to get feedback from the program. They told me where my application was lacking and things that I could do to improve it. And over that year, I ended up getting shadowing experience. I volunteered with one of the genetic counseling research groups at UBC, and I feel like that year I really not only improved as an applicant, but I became a lot more clear on what the program was going to be like and what the role of a genetic counselor is. And so the second year, I used kind of my gap year to work in a research lab as a technician. And then I applied to 3 schools in Canada, and I ended up getting interviews at all of them. And so I was very lucky in that way. And then I ended up matching here in Winnipeg. So I got lucky. I got in on my second try. I know it doesn't always happen that way, and if it doesn't, don't get discouraged because most people get in eventually. Yeah.
Yeah, like you said, Cassie, kind of working on finding more things to get more exposure, right? And things to build your resume. Like you said, it's really helpful when you get that first experience kind of going in, maybe feeling a little discouraged, but kind of taking it and moving forward and kind of getting that other experience is always really, really great. And so thanks for that, Cassie. We'll move even more east to Celine in Toronto.
Thank you, MJ. So I'm Celine. I'm currently a second year in the University of Toronto program. And so I did my undergrad, I did a Bachelor of Science at the University of Calgary. So my Bachelor of Science was in cellular, molecular, microbial biology. So through my undergrad, I had a lot of exposure to genetics courses. And when I was in my second year of undergrad, I did a lot of volunteering at the Alberta Children's Hospital. And this volunteering was with inpatients, so that you got to know quite a few of the families where the patients were in there for weeks at a time. And from that experience, I recognized how much I liked having that direct contact with families, and I wanted to kind of be in a role that would be supportive of these families. And I knew from my education that I had an interest in genetics. So kind of what Cassie and Amy have mentioned, that I think that connection of directly working with patients as well as the interest in genetics, this seemed like a great profession to learn more about. And so what I actually did was I went on Google and was trying to find jobs that weren't lab-based, and I came across the CAGC website. And I was looking at where clinics were, and I found out that there was a genetics clinic at the Alberta Children's Hospital. And so I had actually walked in there one day after volunteering, and I had asked the secretary if it was possible to talk to a genetic counselor, or if there was any job shadowing or volunteer experiences that I could have at the genetics clinic. And so she had given me a contact to one of the genetic counselors. And so I was in contact with her and wanted to learn more about genetic counseling, but they didn't actually have a volunteer position open up until about 8 months later. And I was so excited when I got that email that about the volunteer position. I actually ended up volunteering with them for 3 years while I was finishing my undergrad, and that was a really great experience. But I recognize that's not necessarily something that's available to everyone, to volunteer directly with the clinic, but I think it doesn't hurt to reach out to genetic counselors and ask about job shadowing or volunteer experiences, even if it's temporarily or long-term. And then I also did volunteering at the Distress Center in Calgary to get the counseling skills as well. And then I did some more volunteering, I guess more kind of advocacy work, as MJ had mentioned. So I did some more volunteering with inpatients at the hospital, as well as with some children with disabilities outside of the hospital, which I really enjoyed. But again, I think you want to try to choose volunteer experiences that you have an interest in and that you'll enjoy. And then I had applied right after, I ended up taking 5 years to do my undergrad because I had quite a few extracurriculars. And I had applied to UBC and University of Toronto for the year following my graduation. I got an interview at UBC, but that year I didn't match, so I didn't get in my first year either. And then my second year, I applied to UBC, the University of Manitoba, and the University of Toronto again. And I had interviews at University of Manitoba as well as University of Toronto, and then I ultimately ended up matching with University of Toronto this year. So again, don't give up and don't be discouraged. I think you'll talk to many current students or people who are working in the profession, and many people did not get in on their first try. It's very common for people to have to apply 2, 3, maybe even 4 times, but I think it's very common, and don't get too discouraged or give up if you know it's something that you're really interested in. It's worth the wait.
Exactly, kind of let your passion show, right? And it sounds like you had some great experiences with the volunteering and getting more kind of distress center experience kind of with the time as well. So thanks, Celine. And then we'll move over to Montreal. We'll start with Michaela from McGill. Go ahead, Michaela.
Sure. Thanks, MJ, for organizing this. It's really amazing. So, hi, everyone. My name is Michaela. I'm a second-year genetic counseling student at McGill in Montreal. I'm originally from Ottawa, but I've been living in Montreal now for about 8 years. So I did my undergrad in anatomy and cell biology here at McGill. And to be honest, I discovered about genetic counseling kind of by accident. So I was in a very competitive science program, one of those programs where it's kind of expected that you either go into research or go into medicine. So I was on the med school track, but my heart wasn't really in it. I was just going through the motions, and I actually stumbled across genetic counseling when I Googled, what do I do if I don't get into med school? And the more I read and the more I read about it and really researched it, the more I realized that it, like has been said by some of the other panelists, it combines the things that I'm interested in, which are the genetics aspect and really that one-on-one experience with the patients, counseling them and having that personal relationship with them. In my undergrad, I was able to take a lot of courses on genetics as well as on cancer, which I was fascinated with, and I found that I always drifted towards those types of courses. And so when I stumbled across genetic counseling, I knew that this was likely what I was more interested in and more passionate about. So I applied straight out of undergrad, and I applied to, I think it was 4 Canadian schools, and I, like other panelists, I didn't get an interview on my first try. And I like to say that I wasn't ready. I hadn't read enough about the field. I hadn't spoken to enough people. I needed to really build my experiences. I had some great experiences in my undergrad, volunteering with the peer support center, helping promote mental health on campus. Before starting university, I volunteered as a first responder on an ambulance for a year. But I really needed to learn about the field more. So I actually took 2 years and I did a master's in biochemistry, which if you asked me that when I started my undergrad, I would say that I would never do that. But in my downtime between doing lab work and, you know, I actually was working with viruses, which is timely. I would read and listen to podcasts and really learn more about the field and speak to current students at McGill and also to some program directors to get a sense of what the field is like. I'm one of those exceptions where I didn't have any in-clinic experience before starting. My first genetic counseling session was on my first day of my rotation in first year. So like MJ says, it's really great if you don't have the access, especially now, to just use whatever resources are available to you and to talk to as many people as you can. And you'll find that students are quite open and willing to share. I've had students connect with me on LinkedIn, write to program directors who then put us in touch, and we're more than willing to discuss. So I applied my second time, and I applied to most of the Canadian schools, and then to some American schools. I applied to 9 schools total, and I got 3 interviews, and I ended up matching here at McGill, which was great. And so yeah, so now I'm at McGill and counseling in both French and English. So for those of you who are considering McGill, like MJ said, we have a bilingual population. It is possible to be at McGill and not speak French. It just changes it affects how many patients you might see. But we have students who don't speak French and they enjoy their experiences and they get a lot from it as well. But like everyone has been saying, just build on your experiences, speak to as many people as you can, and don't be discouraged because eventually it'll work out. So just learn from each attempt, and then one day you'll match.
Exactly. And we're so glad you didn't go to med school, Michaela.
Oh, me too. Me
Love
too.
having you in genetic counseling. Thanks so much for that.
Of
And
course.
so we'll move over to Chloe. Chloe,
So
the floor is yours.
yeah. Thank you. So I'm a second year student at the Université de Montréal. So I'm proud to be in the only North American French-based program. So French is my first language. So I'm just gonna try my best to do the session in English. So I'll let you know if it's clear.
You're doing great.
So, yeah. So I did my undergrad at UDM too. So I did a bachelor's in biomedical sciences. And then I had I did an internship also in a research center, so in a lab on cystic fibrosis. And then I heard about genetic counseling in my bachelor's degree. So two of my friends wanted to apply, but fast forward, none of them ended up applying. And I applied and I got in my first try. So I was very lucky for that. But before at UDM, we also have a micro program in medical genetics. So basically we do, it's a one-year program where we do all the theoretical classes of the master's degree in genetic counseling. So I had a lot of exposure and it was a way for me to know a little more about genetic counseling and what it was really on the field. And I also, it was a way for me to stand out because the directors of the program were also teachers in the micro program. So we got to know each other a little bit better. And then after 1 year, I also did volunteer in a support group for Down syndrome based in Montreal and a support group with LGBTQ people also. So we were doing counseling with them. So it helped me a lot to do the counseling. So I applied after the micro program and then I got the interview and I got in on the first try, which I consider myself lucky. Now we are only 3 students right now in the second year program in Montreal. So we're lucky to have one guy with us and one of my friends is from Martinique. So we're a diverse group.
You definitely are in a lovely group. I was definitely hoping that you had mentioned the micro program, and it's quite unique. It's a 1-year certificate program.
Yeah.
And like you said, it really covers the coursework from the genetic counseling master's program without going into rotations or the research.
Yeah.
And like you said, it's a great opportunity to figure out if genetic counseling is for you, and get to know the staff and the functioning of the clinic. Yeah. And even for those who don't go into genetic counseling after that, some go into med school, some go to other places. So it's a really interesting program.
Yeah, it is.
Yeah. Great. Thank you so much all for introducing yourselves. And thank you to everyone who sent us questions. We did get quite a few. We will do our best to get through them. So one of the first things that people have been asking is, again, what experiences people sought before getting into the program. And we did touch on this quite a bit. But maybe I'll start with you, Amy. What do you think was the most valuable experience that you got before going into the program?
I think most valuable,
It's
that's
a hard
tough one.
Yeah.
Yeah, because and this is not the best answer, but all of them are valuable in some way. But I would say most valuable probably would have been experiences where I did get direct exposure to genetic counseling. And I would say that it was valuable not just because it was experience for me, but it was also a constant kind of thinking, reflecting, and evaluating whether this is something I wanted to do. And I think that's important for applicants because this is, not a super widely known profession, and it's challenging to get into. So you want to really know if you're interested and you're invested in this. And similarly, programs are looking for people who are invested in this and really know what it's all about. And so I would say definitely in the opportunities I had to shadow or to volunteer with genetic counseling clinics gave me the kind of both sides of it, like just getting the exposure and then also figuring out if this is what I really enjoy and want to do in the future.
Exactly, using it to really figure out, is this for me or not? Like,
exactly.
Yeah. Any of the other panelists have something to add to that? No, you said it for all of us. And maybe more directed at Michaela, you know, after doing the master's program, did you find that there were many transferable skills that you brought into the Masters of Genetic Counseling from that?
For sure. So one of the biggest transferable skills that you bring in is just that experience with research in general. At McGill, we do a research project, which you decide on your project partway through first year, and then usually you're designing the project from scratch and applying for the ethics approval and communicating with your supervisors and then executing the project. So I already had that experience working with supervisors. I had 2 supervisors in my master's program with different relationships with them, so I knew what I really wanted in a supervisor, and I knew what to seek out when I was seeking out a project. And also just doing a master's in biochemistry or in a lab, you really get to know that basic science aspect of it, which can help you in understanding conditions and how they work, and different ways of explaining it to patients. So having that knowledge really helps in sessions as well, for sure.
Yeah, a lot of kind of professional skills, huh, that you can develop when you're in a master's program like that. Definitely sounds like that was really helpful.
For sure.
Yeah. And more directed at Cassie, you talked about kind of research experience that you did through volunteer work. How did you find that? How did you find kind of external to school research opportunities?
Yeah, it's actually a really funny story. So I knew of a genetic counselor who was working at UBC, and it was very serendipitous. I just saw her on the bus one day, and I went up to her and I just told her that I was really interested in the work that she was doing and that I was interested in genetic counseling. And I asked her how I can get involved and how I can improve my my application. And she said, well, keep chasing people down like this, as a joke. But I think what I took from that was really just reaching out, do some research about what's happening in your area in terms of genetic counseling research. So there might be some more well-known genetic counselors or genetics research teams at the university that you're near. And just ask if they have opportunities. And I think just showing that you are interested and that.
Oh, I think we might have lost you, Cassie. Oh, we'll give her a second to maybe unfreeze. The joys of a webinar. Okay, we'll circle back, Cassie. I'm sorry. But moving from that, Celine, oh, Cassie, are you back?
I'm back. Sorry.
Okay, cool. Sorry,
You
got
all
cut off
froze.
a little bit.
Okay.
We were just hearing you talk about how it's important to hound people and show how much you care, right? And how much you value the opportunities that they may be able to give you.
Yeah, I think you got most of it. Sorry, I think my connection might not be great, but I'm not sure what I can do about that.
Maybe just stop sharing your webcam, yeah, and we'll see if that helps.
Okay.
Thanks so much, Cassie. And Celine, I wanted to ask, how did you go about approaching genetic counselors for that shadowing experience and that volunteering experience? Like how do you make that first step?
So I have to admit, I remember feeling a little bit nervous to kind of put myself out there and ask if there would be any opportunities for me to learn more about the profession. But I worked up the courage one day, walked into the clinic, and I had actually asked if I could speak with a genetic counselor. I had asked the secretary if it was possible. And of course, we know genetic counselors have very busy schedules. So the secretary had gone and talked to one of the genetic counselors, and she had said that it was okay for her to provide, for the secretary to provide me with her email address. And so then it was my responsibility to reach out to her, and I essentially described kind of how I found out about genetic counseling and that I was interested in learning more about it. And there were some specific questions that I also had in mind that I wanted to ask her while I had her email just to learn a little bit more, and then asking specifically about job shadowing or volunteer opportunities. And even though there wasn't something available right at that time, she had my contact information and she knew that I was interested. So she essentially had me on the wait list so that when there was a volunteer opportunity that opened up, I was the first person that she was going to connect with. And it was 8 months later, but I was so excited when I got that email. I remember I was like, oh, like, thank goodness. So I think even if maybe something doesn't happen right when you try to learn more information, it may happen down the road when someone has more time, where there's more volunteer positions available. But I think I was very lucky that I got the experience that I did. I think that's it's not necessarily super easy to be able to do a volunteer position with a clinic for that long. But I think even just job shadowing, even if you could go in for 1 or 2 days, I think it's very, very helpful to be able to see hands-on what a day in the life of a genetic counselor is. Just kind of as everyone else on the panel has touched, I think it is a very niche and very specific profession, and I think it's important to know that it kind of encompasses everything that you think you would want to have in your career. And I think something I even learned in my 3 years volunteering is how much the field of genetics changes, and I think for me that was really exciting. So I think I was able to see that hands-on, how much can change in a clinic in even like 6 months to a year. So I'm sure my panelists agree that I think one thing that's nice about genetics is we're constantly learning.
Yeah.
Yes, always learning. And it's going to be a career of learning too. The next question for Chloe, what kind of experience can help get into the micro program at UDM?
Yeah, so basically you have to, you can have any bachelor's degree in science to apply. We have to have reference letters and a motivational letter to get in to apply. So it's 10 to 15 people that can apply. But prior to the micro program, I didn't really have any volunteering experience. But basically, it was the fact that I worked in a lab for my bachelor's degree that helped me have experience on that. And I was also working at the research center during that time. So I think it helps to show that I was motivated to go in that program, and the fact that I wanted to learn if it was really for me or no. I think that's something that they're aware of, that it's a way for us to know and to stand out if it's something we really want to do.
Yeah, so it sounds like it's a little bit less restrictive, right? You're saying 10 to 15 people kind of get in every year to the micro program. So definitely some of the same kind of information applies, research or counseling experience, but it's not to the same level.
No, not the same level, yeah.
Yeah, okay. Thanks for that, Chloe. Thanks for that precision. And so moving on a little bit more to kind of application-based questions, there are lots of questions about references and personal statements. Maybe I'll start with Celine. Who did you ask for references, and how did you go about that?
So I had a supervisor who was a genetic counselor through my volunteer position that was kind of my go-to person, and so she knew me the best from my volunteer experience. So I was very lucky to have a genetic counselor write me a reference letter. And I also worked with some of her colleagues in other capacities, and she actually had asked them for their input so she could write a reference letter from people that she had worked with and I had worked with, kind of a combined one, which I thought was a nice idea on her part. I also asked my supervisor at the distress center to be able to address kind of my counseling skills and speak to that, as well as I had one of my professors from my undergrad. It was a smaller class, and I was lucky that I was able to get to know my instructor a little bit better, and so I had messaged her even it was at the end of the semester, asking if I could ask for a reference for the following year. So I think that was really important. I think sometimes with academic, if you're able to ask a professor for a reference, maybe asking a little bit in advance when you can kind of get that commitment from them and then remind them once applications open. So I found that very helpful versus asking my professor, say 6 or 7 months after I had taken the class. So that could potentially be a way to go about it with an academic reference. And I think just asking, I think I emailed or I would talk to them directly in person, and I'd usually give them quite a bit of notice. I think that's really important, is to kind of think about who you want your references in advance and give them quite a bit of time, and you can always give them friendly reminders when applications open, but I think they really appreciate having a lot of time to kind of consider it, and it's not a last minute thing.
For sure. Does anyone have anything to add to that? Kind of, how do you even figure out who to ask?
I can add on a bit if that's all right. So for me, I kind of approached it about how do I highlight the different areas that a genetic counseling program might be interested in. So one of the things is to highlight that scientific knowledge, that basic science knowledge. So I got my supervisor from my research program who he knew a lot about me. We interacted daily. He had seen me present. He read my thesis. We had a lot of interactions, obviously, so he could speak to that. And then my other reference was someone who knew me from the peer support center, so they had experience with my counseling skills. And then I got someone who knew me from my other volunteer activities in the mental health sphere. So it's less about getting that fancy person who can speak about you, and really that person who knows you and has experience with you and can really speak to that, write a personalized letter for you versus just a standard, they're great, let them in kind of letter.
Exactly. People who really know you can, like I said, can attest to your skills, right? And know you in that way. And like I mentioned, I do think it's helpful to send them your personal statements too, because then they can get a sense of what you're trying to highlight and they can build off of that. And it's helpful for them too, to not have to go from scratch. And then this next question is a little bit more for Cassie and Amy. How did your personal statements change between your application cycles? So after the first time, after the second time. So let's start with you, Cassie.
Sure. I hope that my connection is better this time. So there was a huge difference between my personal statement the first and second year. The first year, I think I wrote my personal statement kind of just reiterating the things that were on my CV. So talking about the things that I had done, the experiences that I had, and all the reasons why I think I've met their application requirements. So it was not very personalized and didn't really show who I was, but rather all the things that I had done to try and get into the program. The second year, I still talked about some key experiences that I had had through the process of thinking about genetic counseling, but I was able to really show what I learned from them and talk more about the implications of why I think those experiences showed me that this is the right career for me. So it was a lot more interpretive, I would say, about what I learned rather than just what I did. And I brought in some personal experiences through my life and stuff that showed me also why I think it's the right profession for me. So I think that was the key, though, is really you're not just repeating things on your CV, but showing what you learned.
Yeah, exactly. Showing growth.
Mm-hmm.
100% showing growth and showing, hey, I applied, I didn't get in, and look how I improved.
Mm-hmm.
And look how much more I understand. Amy, do you have any thoughts on that?
I have basically the exact same answer as Cassie, which is really funny. But
Yeah.
My first time applying was exactly what Cassie said. I focused a lot on this is what I did. Look at these things, which were already on my CV. Versus the second time applying was much more, yeah, like what are things I'm doing now, but what am I learning from them? What are my reflections and thoughts on them? And in my third time applying, it was like that too, but building even more on that because now I had a year, for example, of interviewing and not getting in, and what did I learn from that experience, and how, what's changed since then, and why am I still going for this, things like that. So basically, I think Cassie summed it up really well, a lot more interpretive the following times that I applied.
Yeah, it makes a lot of sense. So another question kind of about applying, Michaela, what are factors you considered when choosing schools to apply to, especially when you're looking at Canadian schools versus American schools? What did you think about?
Sure. So for me, looking at both Canadian and American schools, the first thing I did before even looking at programs was looking where I knew people. You're going to be moving there for 2 years. It's different for each person, but for me personally, I didn't want to be moving somewhere where I didn't know anyone, especially for such an intense program. So that really narrowed my search. When looking at the American programs, it can be quite overwhelming. There are a lot of American programs. They're quite expensive and they're bigger also. So the chances of getting an interview and maybe getting in are higher, but you have to consider, if you match there, it is binding. So if you're applying to both Canadian and American schools and you match to an American school, are you going to be in the financial position to be able to go there and pay the tuition? Likewise, looking at the class size is really important. Do you want to be in a large group of 20 students, or do you want to be with 3 or 5 students, like in the Canadian programs as well? For me, I was open to both. I also applied to, in the States, there are new programs popping up every application cycle. So I applied to a program at the Massachusetts General Hospital Institute for Health Professionals. I didn't know what it was when I applied. I just researched it. It looked interesting. I know people in Boston, and so I applied. I actually interviewed there, and in those situations, it's really important to ask about what they envision for the program and what they envision for a community of students. It really depends on how comfortable you are being in both Canada and the States, because the practice is quite different in Canada and the States. And in the US, there's a lot more focus placed on insurance and different aspects of genetic counseling than there are here in Canada, where it's available to everyone. So those are things to think about for sure. And then where you could see yourself for sure is a big one too.
Yeah, that's a huge one. Kind of the culture of the places you're applying, what the courses look like, and then do you see yourself even living there and doing school there? Yeah.
Exactly.
Does anyone have anything to add to that? Other things that they thought about when they were looking at the schools, thinking about applying?
I can add something, but not in regard to American schools.
Of course, yeah.
So I'm kind of weird, I guess, in the pool of applicants, because many prospective counseling students don't feel that they would enjoy working in labs, and that's part of what brings them into genetic counseling, but I quite like it. And so for me, the fact that the University of Manitoba had a full master's thesis component was a big part of why I wanted to go here. So that's something to think about. There's definitely unique parts about the different schools that you should take into account.
I'll also just add, MJ, if that's okay. If you're applying to the schools in the States, you might be required to write the GRE test, which is a standardized test to evaluate math and reading comprehension and some of those skills. So it's another step to take really in planning, because they're not held all the time. So it's something to look into well in advance of applying, so that you have time to study and to take the test as well. And it comes at an additional cost as well.
Yeah, that's something to think about too, what those different requirements are between Canada and the States, for sure. And based on kind of Cassie's answer, we are getting questions about what makes each school different, kind of what do you find unique about your school? So general question to the group.
I can maybe speak about the University of Toronto. I know our school has, or our program has quite a bit of courses. There's some courses that are unique to the University of Toronto. So for example, in our second year, we have a cancer genetic counseling course. So you have a full semester of that. And I know that that's something that's unique to the program. So if you're someone who kind of enjoys didactic learning and wants more course-based, that's something to consider. And you still get the same exposure to clinics, but something that I think is also a little bit unique about Toronto is there's lots of specialty clinics. So I think in some other provinces, a lot of the genetics clinics are centralized and they're more general, and they at those clinics they'll see everything. But there's quite a few specialty clinics in Toronto. For example, there's an ocular genetics clinic. There's also cardiac genetics specifically. I know there's other cities that have cardiac genetics clinics as well, but I think that that's something that is unique about Toronto. And we also have all of the main hospitals downtown on the same street, which is when we were in person was a huge bonus, that when you were running between clinic and classes, everything was on the same block. So that was something I appreciated, especially moving to a new city like Toronto.
For sure, that makes things really interesting too, to have access to different kinds of specialty clinics and different kinds of courses, and definitely something to think about. Does anyone else have anything to add to that? Okay.
I can add to it. Oh,
sure. Yes, go ahead. Go ahead, Amy.
Yeah, I was going to say at UBC, something that we have here is we pretty much start in the clinic on day one. So our rotation schedule is out, and then we're in the clinic on day one, and we're allowed to be involved very early on. So for me, like, I was speaking in a first session like the second week of school, which sounds terrifying, but also it was a great way to just get pushed into it and get started without building anxiety for me. And so in that way, I think the breadth of clinical experience I've been able to get from the program at UBC has been really great for my own exposure. And on top of that, just a variety of different clinics. And in Vancouver as well, I'll just say we do have one specialty clinic that is a bit unique, and that's in psychiatric genetics. We have what's called the ADAPT clinic here, and we, as students, we do get exposure and the opportunity to rotate through that clinic, and that I think is a very unique experience to UBC, and honestly something that I'm hoping other places will be developing in the future as well.
Yeah, for sure. Psychiatric genetics is very interesting, and not very many clinics in Canada right now. So it's nice to have that right near you. And Joey, people are asking, when you do the micro program, and how does that change your trajectory in the master's program? Do you have to repeat the same courses?
No, so that's it. Since I did my theoretical classes in the micro program, I didn't have to do it in the master. So the first year I didn't have any classes, only some workshops to do, and I had my observation and clinical rotations. But the clinical rotations only started at the second semesters.
Okay.
So in the first semester we're only doing like theory, the classes. And then we start later on. But we also have a clinical rotation in the diagnostic laboratories. I don't know if the other programs do that, but we actually go into the labs and talk with the supervisor, and we do karyotypes and stuff, and stuff like that.
Okay, so some hands-on learning with the labs to kind of see what kind of tests are you ordering? What does that look like? It's really interesting.
Yeah.
Thanks, Joey. And so kind of moving on from this the application kind of more to the interview process, maybe I'll start with you again, Chloe. Kind of how did you prepare for the interview process? Like, what did you kind of think about or do in preparation?
But like the others said, I really prepared myself just to talk about my experience and how it could help me in the job, in the program. So I asked myself a basic question just to talk about myself, just let them know that I think that what would make me be a good genetic counselor. And like the others said, I think it's just the fact that I love counseling, I love science. It was, I just wanted them to let them know that just to talk about how I stood out in the program, and
for sure highlighted how motivated you are and what experiences you had. So you kind of, in preparation for the interview, kind of thought about how to show that.
Yeah.
Okay. Did anyone else have any specific things that they did in preparation for the interviews that maybe helped them feel a little bit less stressed? Not specifically.
I can speak to that a little bit. So I think definitely I agree with Chloe, like thinking about what you've learned from your experiences and why you think that this is the career for you, but also try and have think about some issues that are like in current events or relating to genetics as a field that you might be asked to kind of talk about or discuss, because oftentimes in interviews there are lots of questions about you, but they might ask questions about your opinions about certain issues or about situational type questions. What would you do in this scenario? So try and think about sort of some of the ethical questions that might come up in a genetic counseling practice, and sort of just consider how you might answer some questions about those types of things can be helpful.
Yeah, kind of thinking from the program's perspective, what kind of questions do you think they're going to ask, and kind of brainstorming about that. Like you said, kind of getting an idea of the current events or issues that come up frequently in genetics, and kind of thinking about that. Definitely sounds like a good way to prepare. I definitely did a lot of that too, just kind of figuring out, like, with all the things that you've read or all the podcasts that you've listened to, kind of having an idea of questions that might come up frequently. Yeah.
I think something else. Oh, sorry, MJ.
No, please go ahead.
I think something else to remember, it seems simple, but reread your personal statement and your CV, because they actually read them and they might have them in the interview with you and have questions for you. So it's good to know what you wrote. It might have been a few months ago. So just to be familiar with how you framed your experiences so that you don't just answer with something that they're reading on your statement as well.
Very true. Very true. And someone is asking, is it okay to be an applicant not applying straight out of undergrad, or at what point is it too late to apply to genetic counseling? Is it ever too late? I'm seeing lots of no's. Maybe I'll just speak to that. There are people who come to genetic counseling after 10 years in a different career. It's never too late to apply if it's something that's interesting to you. And that other experience that you have is only extra value, extra experience that you have, extra skills that you have. So definitely not too late to apply to genetic counseling. I know one of our supervisors when I was at McGill, she had come into the career later in life and loves it. So not too late.
MJ, I'll maybe just add something. So one of my classmates, she's actually, so she was a high school biology teacher for 10 years, and she has 4 kids at home, and she came back to school and she's killing it in the program. And so I think that kind of just speaks to, I think, no matter what age you are or what life experience you are, or how long it's been since you were in school, I think just kind of saying what MJ said, I think you can go back to school at any point, and if you're interested, I think it's worth it.
Yeah, definitely. Definitely. We're also getting a lot of questions about kind of what it's like to be a genetic counseling student right now. So maybe can I start with Amy? Did anything surprise you when you came into your program? Anything that you weren't expecting?
I want to say, like, in my experiences talking to like current students during interviews and things like that, the students are quite good at communicating what the program is like and kind of what to expect. But I think it's a little bit different when you go in there and experience for yourself. It's one thing to be an organized person and be like, okay, I'm going to go through my to-do list today, and I'll manage my time well so I can get through like preparing for clinic and doing the homework. But then once you're in it, I found anyway that things quickly kind of mesh together, and then you really have to actively be like, okay, what are my priorities today? What can I focus on? And how am I going to organize my time to make sure I get through everything? Because you probably do want to get through everything. And so I think it's not surprising because you'll hear from a lot of people who go through this these programs and go through this profession that, you know, these programs are there's a lot to learn and a lot to do, but once you're in there, you'll find that you really have to make an active effort to organize your time well. And then in addition to that, make time for your own self-care, because with all of that, you don't want to get consumed by all of it and not have time for any other things, for your, you know, outside relationships and friendships, for your outside hobbies and activities. And so that's something I think that I had to experience to really understand.
Mhm.
Yeah, I think that's a common theme. I personally felt that too, right? That kind of feeling of, okay, I need to balance things, and it's okay to not be perfect at everything and not do every single reading, because I need to prioritize myself and my mental health too. I think that's really important, Amy. But yeah, it can be a surprise. Anything else that people found surprising going into the program, things that they weren't expecting, things that were different than what they thought? That's okay, if it comes to you, you can come back. But we are getting a lot of questions too about what's changed with the current situation with the pandemic. How have classes changed? Maybe I'll start with you, Michaela. What's it like being a student in genetic counseling right now?
Sure. So what I can say is a lot has changed, but also a lot is still the same. So we were kicked out of the hospital, MJ was there, on Friday, March 13th for the COVID, and we have not been back since. So lucky for me, I had finished all of my rotations by that point, but some of our students were, their rotations were cut short for their first year, so they ended up making them up. Early at the end of the summer before our second year started. Another thing that changed for us in Montreal, because we were one of the more intense COVID zones, is that our summer rotations were canceled. So normally we would go for between 4 to 6 weeks somewhere in Canada or internationally to do a bonus rotation, but our school would not allow us to do that. So we are missing a bit of experience. Right now, we're working 100% remotely, so seeing patients on Zoom or by phone, and meeting with our supervisors by Zoom. So that's something that has changed, but the consensus among the group is that it hasn't changed as much as we expected. You can still build that relationship with your supervisor. You can still have that motivation to get things done. You can still build that rapport with patients in sessions and really have amazing sessions, both on the genetics basis, but also psychosocially. So it's been really interesting to see that shift for us as well. But excuse me, it is harder because you're not with your fellow students every day. At McGill, we're 5 students per class, and we're used to being in the student room and coming in after an interesting case or also a frustrating case and kind of debriefing with each other. So it does take a lot more effort to have those relationships and also to engage with our first years, to have that sense of community. But really, a lot has changed, but it's still an enriching program. We don't know how long we're going to be working remotely. I know it's different across the country, but here we're really in our second wave. So things were looking like they'd be opening up soon, and then we kind of got hit again. But we're getting all the experience we need. We're seeing the same amount of patients that we would see. We're engaging in almost every aspect of the clinic, and it really has been a good transfer for at least the McGill system, I'm sure for the other schools as well.
Yeah, definitely sounds like things went online for many schools. I know some of the schools are still doing some in-person clinic. I think you are, huh, Chloe?
Yeah, so prenatal and pediatric, we still see patients at the hospital. And so fortunately, I was able to go back at the hospital. We're doing our class, since we're only 3, we're doing at the hospital. So we are able to see each other and then discuss, unfortunately, unlike Michaela, so we're able to discuss our cool sessions. And so yeah, but in the adult setting, we're doing it by Zoom, but I still have to go to the hospital to work there. So we can work remotely.
Yeah, so definitely differences in terms of clinic, and differences in terms of how classes look, but overall still getting experiences, still getting to see each other, even if it's on, video conferences, and getting the support from our classmates, which is always super important. And I am seeing the time, and I can't believe how quickly things have flown by. One other question that I did want to answer, people are asking, it's a competitive program. Is it hard to find jobs in genetic counseling? And I actually just started as a full-time genetic counselor, so I just went through the job search. I would say that it's very different because there's such a bottleneck when it comes to getting into the programs itself, that once you're done the program, there tends to be a lot of demand for genetic counselors. So I didn't have a problem looking for jobs. That said, it is different in different provinces and in different areas. So if you're thinking, I'm a genetic counselor, I only want to work in a certain city, in a certain discipline, then it might be more tricky finding a job. But if you're open to different disciplines, especially in the beginning of your career, disciplines, I mean subspecialties, in the beginning of your career, if you're kind of flexible on location, it's quite easy, actually. There's a lot of jobs for genetic counselors, so that's not something to be too worried about. And so lastly, I want to ask the group what they are finding the most rewarding or the most challenging, broad question, in their programs. And so I'll start maybe with Celine. Any kind of thoughts on what's challenging, or what are you really, really enjoying of being a genetic counseling student right now?
So I think something that's felt very rewarding as I've started, so I'm well into my second year now, is I'm really, as Michaela had mentioned, we're seeing patients virtually or through video conferencing, but I really have, I don't think that this has been any sort of disadvantage to me. I feel like my skills have progressed and I'm still learning and developing the skills that I need to be a competent genetic counselor. And so that's something that's felt really rewarding this year, is I've noticed that I'm starting to feel more and more like a real genetic counselor with my patients and taking on cases independently. And so that's something that I'm able to see my growth myself, as well as comments from supervisors. Of course, always things to continuously learn and work on, but I think it's just nice to see that progression. Another thing that's very rewarding about the program, I don't think we've necessarily touched on, that was maybe a little bit unexpected coming in, is the relationships you build with your classmates and that support system and that community with your classmates. I think coming in, I didn't really know what that dynamic or what that environment would be like, but something that's been very rewarding for me, and I'm sure it's similar in the other programs, is you really become a family and very supportive of one another. And I think that that's really, I think it's kind of something that's a little bit unique and special to genetic counseling, is it's such a small program that you become so close with these people. And so that was something that was very rewarding for me, kind of unexpectedly coming in, and I'll be very thankful for those relationships for the rest of my life. In terms of challenging, I think we've kind of already talked about it. I think this program is very, you have to be very organized and have good time management skills. And I think that's something that you will have to adjust to and learn to throughout your entire time in the program. And so I think that's something that I find the most challenging. And I think it's good even beforehand to think about ways that you can ensure that you can meet the demands of the program in grad school, and kind of to better organize yourself and have those time management skills. Because that is, I think, one of the hardest parts to adjusting to the program, especially in first year, was the schedule and how to organize yourself, and your time management skills was, I think, by far the most challenging thing I found.
Yeah, definitely nice to think about that beforehand. And it's something that can come up when you're talking about like being ready for the program, when you're talking about interviewing and stuff like that. It's something that you can speak to as well. It's kind of how you anticipate reacting to all of that. And so lastly, in the last few minutes that we have here together, I'll just invite each of our panelists to finish off with a few last thoughts, a few words of advice, or helpful things that they want to make sure to say just before we end off. So I'm going to start on the East Coast this time. We'll start maybe with Michaela. Sorry.
Okay.
Sorry.
Yeah, so I mean, it's been really great to speak with all of you and to answer all of your questions. And I think this is a really great step in being prepared for an application, is getting that exposure to people who are in the field. So I would say continue doing that, continue reaching out, continue speaking to people. If we didn't answer all of your questions, which I'm sure we didn't, reach out to specific program directors, reach out to students and see if they can help you as well. On another note, I think like for applying, in a way, don't be too humble. The experiences that you have are amazing and they make you great. So really try to highlight those and highlight what you've learned from them. And I guess like we've been saying this entire time, if it doesn't happen the first time, it's unfortunate, but keep trying. And if it's eventually it'll stick and you'll end up in an amazing field working with amazing people.
You're so right. Don't be humble. People say that all. They don't say it enough. You need to show all your skills and make sure people know that you put in a lot of important work. Thanks, Michaela. So, Chloe, any last thoughts?
Pretty much what Michaela said. You just have to be and believe in yourself, because just being in the program, sometimes we doubt a lot. And that's why with our colleagues, we try to build ourselves up sometimes, but you have to believe in yourself and you're going to get through if it's something that's really for you. And don't hesitate to contact us in Montreal if you have any questions for the micro program or the masters. We are free and happy to talk to you guys.
Lovely. Thanks, Chloe. Cassie, that's not the right order. Cillian.
So something that, and I'll maybe add, which I feel like is probably sounds very cheesy and very obvious, but I think during the interview process, you really should just be yourself as much as possible. I think the program directors want to see that in the interview. They don't want to hear, they don't want to hear answers that seem scripted or that you think they may want to hear. I think just being yourself, and then I think that also helps you really see what feels like which program would be the best fit for you. I think that's really important in the interview process, is making sure that as much as the program is interviewing you, you're asking the questions you need to and talking with students during that interview process to make sure that program is the right fit for you, because each program has a little bit different, and the match process is legally binding. So I think just being yourself, and then I think the match process will work out in the best way possible, that the program feels like you're a good fit and you feel like it's a good fit for you. So very cheesy advice, but I think it's honestly sometimes the most simple advice, and you should stick to that.
Agreed. Thanks so much, Cillian. Cassie?
Can you hear me?
We can hear you, yeah.
Okay, well, I'm sorry you can't see me, but hopefully you can keep hearing me. So I would echo everything that everyone else said, definitely. And also, like, if you don't get in the first time, and I think I speak not only for myself, but for the other panelists as well, like, it's not necessary, it's not the end of the world, first of all. It'll be discouraging, but you can kind of look at it as an opportunity to learn a lot more before you get into the program and kind of get, oh, can you hear me now?
You can, yeah.
Okay. and just kind of get more experience. And the way that I look at it for me is that it was kind of meant to be that I didn't get in that first year because I ended up at a program that I think feels like home, and it feels like the right place to be for me. So just don't be too discouraged. It'll work out eventually.
I love that. Last but not least, Amy.
I would say cut yourself some slack. It's really hard to be an applicant, especially when you look at the requirements for programs, and if you know another applicant and you're thinking about what other people are doing, and you're thinking, oh my gosh, these are all the things I need to do. And a lot of people who apply are very type A or perfectionist, and even if you're not, there's a lot of stress associated with that. So give yourself a break. You know, if you're not getting all of the cookie cutter experiences, that's okay. There are people who don't get those experiences and make it into programs. And there are a lot of alternative ways to get experience, to get exposure. So it's easier said than done, but try and give yourself, you know, some space to breathe, and some time to think about other things that you enjoy in your life, and not just get holed up in this whole like application cycle mindset, because it can be very easy to fall into that trap.
It definitely is. So be kind to yourself is definitely a great way to finish this. And I'm just trying to see it. Can people see my screen now? Oh, they can, but I can't. Okay, here we go. I just wanted to thank everyone so much for joining us. Thank the lovely panelists for all their advice and sharing their experiences with us, because it's really very helpful when thinking about applying to all these programs. I do want to leave you all with my contact information, my McGill email. As student rep, you are more than welcome to email me any questions that we didn't have time to address. If you have any specific questions for any of the panelists themselves, feel free to send them to me and I can share them with the panelists. And I know all of them are definitely willing to take those questions and to help you all out on your journey. Any other questions about genetic counseling in Canada, you can definitely send them to the Canadian Association of Genetic Counsellors. Their email is also here on the slide. And last but not least, I did want to say one other thing about Genetic Counseling Awareness Day that is on November 12th. There are lots of places and programs that are organizing activities for the Genetic Counseling Awareness Day, but the CAGC is also hosting questions and answers about the field on their Facebook page. So more than welcome to check that out there. So with all of that, I will now stop sharing my screen, hopefully. Maybe?
Yep.
Okay, well, I can't see you, but I'm sure I'm sure I have stopped sharing it. But all that to say, thank you so much for joining us. Send us your questions, and we will end it there. Thanks, everyone. Have a nice evening.
Thank you, MJ.
Thanks. And then I'm just going to ask Dana to maybe help me stop the webinar.
Bye, everyone. See ya.
Bye,
Great job.
Bye.
Bye.
Are we still recording or still live?
I think so.